All right, best friends, let's prep my clinical bag. I don't know about you, but I start school again in 7 days, and this term is especially clinical heavy, so let's prep my bag. Welcome, my name is Julia, and I am a final year nursing student. I will be graduating in just 6 short months, so let's pack my clinical bag as this term is very clinical heavy, so everything needs to be prepped and ready, and I think I left my clinical bag a mess the last time I saw it, so let's organize everything. So the first thing I have here is just a little binder. This holds all my important paperwork that I'll use throughout the term. So I'll probably be going through this and weeding out some documents that I don't need. So this is my Holy Grail binder. It has everything I need for the term and anything I might need. This is sort of what others might use their foldable clipboard for or their clipboard for. I personally just find those very unnecessary, and binder just does great for me. It's easy and it keeps my documents clean and organized. So what I have in here is I have just a couple of blank pieces of paper. This is just gonna be for where I write all my patient information. I do have this patient sheet that I got from Ashley Adkins. She is really great with all her resources, which brings me to the sort of critical thinking checklist that she has. I also have that in here along with my scope of practice, which is very, very, very important to have to make sure that you're not working outside your scope. This is the first thing that's going into my bag. For my bag, I just have a very simple little duffel bag. It is small, it fits everything I need, so this fits just perfectly down here. Now this case will probably be a mess. This is all my little skill things that I might need, so let's open this up and see what's in here. Oh yeah, okay. So we have my stethoscope. I used to have a stethoscope case and I found it so annoying, so I just switched to a little computer case, and I found this has worked so much better for me to hold all my stuff. Okay, so in my little goodie bag, I also have a pen and a pen light, just a couple. These are my favorite pens. They're from Amazon. They are like amazing. They write so skinny and I really love them. Right here, I'm holding my Holy Grail. If I don't have this on a shift, I will always need it. This is basically the skills I have learned. So not only does this have like a checklist of what I might need for the skill, but also I've included in here little things such as like wound care and like the prioritization task list, the code statuses. This is just like a little snippet of like an additional brain, if you want to call it. So I definitely highly recommend making yourself one of these. Also in here are my badges. So on here I have a couple little badge buddies. I don't really reach out to them very, very much because I have my brain, like I mentioned, but I have my school badge and my work badge, and yes. On that note, I have a couple extra badge reels in here. This one is from Sparkle Name Badges. It shakes, it's like a little shaker cup, and I love them. Along that line, I also have my nameplate. So this is a magnetic nameplate that I can put up on my chest level because I don't like wearing my badges up high, so I put my nameplate high and my badge down lower. In here, you'll also find my glasses. These are just blue light glasses, but I sort of use them as stoggles. Additionally, I just have a little pencil case, and this just has a backup of pens. So let's pack this all in here. All right, I know this looks and seems hefty, but it's everything I will need to have a successful clinical shift. So this just fits right in here. So amazing. So that's what my bag looks like so far. So the last little bag here I have is a little emergency bag, and this just has all my sort of extra supplies that I might need. So I have some extra goggles in here. I've got a charging cord because why not? I've got my little pocket pharmacy because that's always a necessity. I've got some caffeine packets, which are definitely important to have. Some toothpaste because if you're feeling not fresh, you know, extra hair ties, and some mints. All right, this bag just makes it in there as well. Alrighty, now that we have our bag packed here, I always have an extra headband if I'm just not having a good head day. So I tuck that into that little inside pocket. We always have a lock with us because you never know if you're gonna need a lock. So that goes into a little inside pocket in here, as well as a little lip balm because we all know that the hospital is dry. Along with that, I usually clip a little hair clip to my bag. And in here, I'll also try to stick in an extra pair of scrubs and some compression sleeves. And yeah, this is everything I have in my clinical bag. It is basically all my supplies that I need to have for a successful shift. This is how I feel prepared. And this is how I have been successful in my clinicals. So that was what's in my clinical bag. If you have any questions or want to know anything, just shoot me a comment or a DM and I will do the best to answer. As always, you can find me on my other social media platforms at Julia Gretters1995 and I will see you there.